Hello everyone. I am Rathod Nikita, student of Elite Institute of Pharma Skills Pune. I am here to present a presentation on an overview to medical coding. Now we'll see what is medical coding. Medical coding is the transformation of healthcare diagnosis, procedures, medical services, and equipments into universal medical alphanumeric codes. The medical coding professionals help ensure the codes are applied correctly during the medical billing process, which includes abstracting information from documentation, assigning the appropriate codes, creating a claim to be paid by the insurance carriers. Now we'll see the skills required for the medical coder. The medical coder should have a thorough knowledge of medical terminologies. He or she should be clear with the basics of anatomy and physiology, analytical skills also. He or she should be a good handler of ICD 9, ICD 10, CPT, and HCPCS coding. He or she should also know about LCD and NCCI guidelines, HIPAA compliance, and medical billing concepts. He or she should be a detail oriented and, most importantly, self motivated person. Now we'll see the medical coding process. The medical coding process consists of 5 steps. First is the pre-coding, second CPT, ICD-10 and HCPCS coding. Third, client feedback, fourth, quality check, and the last is access patient charts. Now we'll see what is ICD-10. ICD-10 stands for International Classification of Diseases. Medical coding is performed all over the world with most countries using ICD. ICD is maintained by the World Health Organization and modified by each member country to serve its needs. It contains codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. Work of ICD-10 began in 1983 and became endorsed by the 43rd World Health Assembly in 1990 and was first used by the member states in 1994. The ICD-10 consists of chapters from 1 to 22. ICD-10-CM stands for International Classification of Diseases, 10th edition clinically modified. ICD-10-CM includes codes for anything that can make you sick, hurt you, or kill you. The 69,000 code set is made up of codes for conditions and diseases, poisons, neoplasms, injuries, causes of injuries, and activities being performed when the injuries were incurred. Codes are smart codes of up to 7 alphanumeric characters that specially describe the patient's complaint. Now, there is a diagrammatic representation of the 7 alphanumeric characters, that is as follows. Now we'll see the anatomy of an ICD-10 PCS code, that is procedural coding system. The first stands for section, the second for body system, third for root operation, fourth for body part, fifth for approach, sixth for the device, and seventh for qualifier. Now we'll see the detail of the 7 alphanumeric characters. The first is the section, which relates to type of procedure. Second, body system, which refers to general body system. Root operation specifies objective of procedure. Body part refers to specific part of body system on which procedure is being performed. Approach is the technique used to reach the site of the procedure. Device specifies devices that remain after procedure is completed, and the qualifier provides additional information about the procedure. Now we'll go one by one towards the codes used in the medical coding. The first one is the CPT. CPT is also called as current procedure terminology. Medical code set that is used to report medical, surgical, and diagnostic procedures and services. Code set is a medical code set maintained by the American Medical Association. There are three types of CPT codes. First is the category 1, second category 2, and third category 3. CPT is a registered trademark of American Medical Association. Now we'll see one by one the categories of CPT. The CPT Category 1 covers procedures and contemporary medical practices. They are broken down into six sections. First, evaluation and management. Second, anesthesiology. Third, surgery. Fourth, radiology. Fifth, pathology and laboratory. And sixth, medicine. The category 2 medical code set consists of supplementary tracking codes that are used for performance measures and are intended to help collect information about the quality of care delivered. The use of this medical code set is optional and is not a substitute for category 1 codes. The category 2 is also called as clinical laboratory services. The category 3 is a code list which consists of temporary codes that cover emerging technologies, services, and procedures. They differ from the category 1 medical CPT codes in that they identify services that may not be widely performed by healthcare professionals, may not have FDA approval, and also may not have proven clinically efficacy. The purpose of these CPT codes is to help researchers track the emerging technologies and services. Now we'll see what is HCPCS. The HCPCS stands for Healthcare Common Procedure Coding System. The HCPCS is produced by the Centers for Medicare and Medicaid Services, that is CMS. HCPCS is a collection of standardized codes that represent medical procedures, supplies, products, and services. The codes are used to facilitate the processing of health insurance claims by Medicare and other insurers. The HCPCS is divided into two subsystems, that is, Level 1 and Level 2. The Level 1 is comprised of current procedural terminology codes, that is HCPT. The HCPT codes consist of 5 numeric digits. These codes are for hospital providers. Level 2 HCPCS codes identify products, supplies, and services not included in CPT. It consists of a letter followed by 4 numeric codes. These codes are for hospitals, physicians, and other health professionals. Now we'll see the modifiers. CPT and HCPCS level 2 codes are hundreds of alphanumeric 2-character modifier codes to add the clarity. They may indicate the status of the patient, the part of the body on which a service is being performed, a payment instruction, an occurrence that changed the service the code describes, or a quality element. Now we'll see the CPT modifiers and HCPCS level 2 modifiers in detail. The American Medical Association, that is AMA, holds copyright in CPT. CPT modifiers are generally 2 digits, although performance measure modifiers that apply only to CPT category 2 codes are alphanumeric, like 1P to 8P. There are examples of some of the most used CPT modifiers, like 25, which stands for Significant Separately Identifiable Evaluation and Management Service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. 26 stands for Professional Component and 59 for Distinct Procedural Service. Now we'll see the HCPCS Level 2 modifiers. HCPCS Level 2 codes and modifiers are maintained by the Centers for Medicare and Medicaid Services, that is CMS. HCPCS Level 2 modifiers are alphanumeric or have 2 letters. Below are some examples of HCPCS Level 2 modifiers. Even. Even stands for upper left eyelid. TC, technical component, and XS stands for separate structure, a service that is distinct because it was performed on a separate organ or structure. Now we'll go towards the medical billing. Medical billing is a process of submitting and following up on claims with health insurance companies in order to receive payment for services rendered by a healthcare provider. Medical billing translates a healthcare service into a claim. Now we'll see what is medical billing process. The medical billing process consists of 7 steps. The first is the registration. In registration, the documentation of the patient's information is done. After that, it is followed by insurance verification. In insurance verification, the insurance information submitted by the patient at the step 1 is toughly verified. Then it is further carried by patient check-in and check-out. Then checking code compliance, then preparing and transmitting the claims. The prepared and transmitted claims are audited in auditing claim. And then finally the claim is submitted in the step claim submission. We'll have an example to get a brief idea about what is actually the medical coding. This is a 40-year-old male with rectal pain, rectal bleeding, and some left sided lower abdominal pain. The colonoscopy procedure and the risks not limited to bleeding, perforation, infection, side effects from medication, need for surgery, etc., and were fully explained to the patient, and informed consent was taken. Instrument used CF Q160. Sedation worst 5 mg IV in incremental doses and Demerol 100 mg IV in incremental doses performed by the anesthesia team. Extent of exam up to cecum as identified by ileocecal valve and appendiceal orifice. Length of scope insertion 110 cm. Post-op diagnosis or impression. First, moderate sized internal hemorrhoids, and second, mild diverticulosis. The description of procedure. With the patient being in the left lateral position, first digital examination of the rectum was done, which was unremarkable. Then the CFQ160 was passed through the rectum under direct visualization and advanced all the way to cecum. The cecum was identified by ileocecal valve and appendiceal orifice. There were a couple of tics or diverticula seen on the left side of the colon. A careful look was taken while withdrawing the scope. Retroflex view in the rectum showed moderate sized internal hemorrhoids. Plan Anisole HC suppositories for hemorrhoids, high fiber diet, and if there is no family history, a follow up colonoscopy in 10 years. The CPT code was derived as 45378 and ICD 10 CM codes K64.8 and K57.30. I hope this have given a brief idea about the medical coding. Thank you.